Okay, so I am so wicked excited to be interviewing my friend and colleague, Amy DeGatta. Amy is a assistant professor of the College of Nursing at the University of Rhode Island, and has a long history working in the newborn intensive care unit. Her passion is really about looking at how the environment, and even more particularly, how care practices impact the infant, and certainly physiologically, but what her real interest is really at that genomic level. She did this wicked cool study around her dissertation for her PhD, examining stress exposure over the first, I think it was like 3 weeks of NICU experience, looking at a specific genotype, this FKBP5, which is a gene that is somehow connected to the HPA axis. And then she looked at neurodevelopmental outcomes. And this has really informed the work that she continues to do, really examining how this stress or trauma, as we're now calling it, changes the individual, changes these patients at that genomic level, and then really goes on to derail their healthy developmental trajectory. I hope I captured that okay, because that's a pretty big intro, but I'm so wicked excited to have you here.
Thank you, Mary. I'm always excited to talk to you, so thank you. And yeah, that introduction is perfect. That's exactly what I'm interested in and what I've been working on, so yeah.
That is so cool. So how has this journey kind of unfolded for you? I mean, I know you've worked in neonatal nursing for quite some time, but now kind of in this new role as a professor and a researcher, how has this background really kind of informed the path that you're going to take?
Yes, that's a good question. I have been a nurse, I can't believe it, for just about 19 years now, almost a big milestone of 20 years. And I think it is all of that clinical experience, all of which my bedside practice has always been in the NICU. And so that has really informed where I am today, what I'm interested in, the questions that I want to ask about how to improve clinical practice for preterm infants. And it's not so easy to just say that, and I am one person amongst many other people, you included, Mary, who want to improve clinical practice. But as I was saying, it's not so easy to do that. And it has to be done in steps and stages, and it has to be done in a way where you're finding evidence for why current practice might not be the most optimal. There's a lot of things we're doing really well, and I'm really proud of my time as a clinician in the NICU, and I'm really proud of the work that all of our NICU colleagues are involved in on a daily basis. However, we're never done, right? It's we're always chasing the carrot to improve, and the NICU and clinical practice is one of those areas where we can continue to grow and improve.
I love how you emphasize the practice dimensions, and just knowing you, I love how it's not just about you doing the research and yay, cool, publish this paper, but you're so passionate about making sure that these new findings, this new information gets translated into clinical practice, that you really are a facilitator, bridging that knowledge transfer, which I think is so important. And I'm sure as a researcher, it can be really frustrating to see so much new knowledge not make it to the bedside.
Right. I would not be in the role I'm in right now if it weren't for my passion for that clinical aspect of things. For me, everything that I'm involved in goes back to how does it improve patient care? And as you said, every step of the way, every publication, every study, everything it's with that in mind. And that's the sole purpose of the work that I'm doing. So yeah.
And you can see it in your publications too, and in working with you. I mean, that's the thing that I love about the work that you do, along with your other colleagues as well, for sure, And so, coming to the Science and Soul, it's really kind of taking this idea of developmental care and really advancing it as a concept and and having a better understanding of the biology related to these developmental care practices, and really in, helping the clinician understand the biology, so that then when these new insights come forth, these new best practices, they can make those connections in a more welcoming way. Because I do find a lot of folks are pretty resistant to change, just off, at first pass. Do you find that also?
Yeah, absolutely. I think change is scary, right? And when you are responsible for life-saving care of human beings, and what you've always done has worked for you as far as you know, the need to change then becomes a little cloudy in terms of like, why would I need to do this? But, I'm nothing if not authentic in sharing my background. As a new nurse, I remember learning about developmental care and really thinking it was this isolated area of practice. We had certain people who were specialists within developmental care, but it was about positioning, it was about alignment, it was about light and dark. And while all those things are important, even the word developmental care feels like we have an opportunity to take that a little further, because I don't think it says enough about what it's all about. The basis of that is preserving brain health. And I think if we gave it a name, like brain care or brain health, you use neuroprotective care a lot in your writing, in your talks, and that's stronger than developmental care. You know what I mean?
Oh, absolutely.
So even the language we use, I think we can advance that a little bit and really be focusing on what are all of these practices that we put into place, and all of the things that we're aware of in terms of stress, in terms of pain that's inflicted on these babies, and just being more mindful that all of this is related to helping support brain health.
I love how you focus on the language, and I know we've had lots of discussions about this in the past, about the language that we use really as a reflection of what we think about something and or what we acknowledge about something. And so this is a nice segue into my next question about your thoughts about this concept of trauma-informed care, specifically within the newborn intensive care unit environment.
Yeah. So that's the term that I have come to be familiar with over the last couple of years. As you said, you and I have talked about this a fair amount. I think we've all heard the phrase, when you have the opportunity to sort of walk in somebody else's shoes, it gives you a new perspective on things. And trauma-informed care, it really, at the heart of it, is having an appreciation for things that have happened in people's lives that bring them to where they are right now. And so that means a lot of different things, depending on the individual person, where they are, how old they are, what their experiences are. But for the infants that we care for in the NICU, having an awareness that every single intervention that we do every single day could have a meaningful impact on their brain health, helps to inform all of your care delivery in just a different way, and having an appreciation for how traumatic the newborn intensive care experience is for babies.
I just have to pick up on your comment, because I love how you're explaining this, and that it's not a one-size-fits-all type of an approach. And that's also part of your background research, right? Looking at why are some babies more vulnerable than others? Why are some babies more resilient than others? And I think we need to be fully present for that reality, that every single individual we care for is their own unique person. And so really being aware of that, I think, will help allow us to be the better version of ourselves, right? In the caregiving, right? Really being present, whether we're a nurse, a physician, a therapist, a social worker, whatever that discipline is. I think the trauma-informed care idea is, again, not what's wrong with you, but what happened to you. And there's so much happening to these people and their families. They're also traumatized. And ourselves, we're equally traumatized. And so really, it's a trauma-informed care and I know when I started this whole thing, I really was focused on the baby, but it's really expanded, for us to really embrace all of the people that inhabit that space are certainly vulnerable to the trauma that is just inherent in an ICU setting. And so kind of taking all of this now, and wrapping it up around the Science and Soul conference, right? The second, I'm so excited, the second annual Congress for Trauma-informed Neuroprotective Care. And I'm wicked psyched that you're going to speak there. And I just wanted to ask you to just share maybe a little bit of what you're thinking you're going to talk to the participants about at the Congress.
So we are in the process of finalizing data analysis of a huge a huge data set of stress information. So this is related to two different cohorts looking at stress exposure in the NICU and how it's influencing short and longer term neurodevelopmental outcomes. Nice. So I'm excited to be able to present that to the participants, and to also include in that our gut microbiome analyses are done. So we have looked at stress exposure as it relates to the developing gut microbiome, and we've also looked at stress as it relates to skin cortisol samples. So being able to just sort of take all of that data related to stress exposure and what is it meaning to the infant's biology. Is really important for clinicians. So I'm excited to share that.
Well, gee willikers, I'm wicked excited right now just listening to what you're going to say, and just to also share, you will not only be just presenting this material, but we're also going to have these little segments, these fireside chat with the experts, where you'll actually be able to sit down with Amy in this lovely setting and ask questions that maybe you couldn't think of them right after the session, but now you're going to get to sit down with Amy for 20 minutes and just barrage her with questions, pick her brain. Hopefully don't pick too much of it because it's a wicked smart brain and she's going to be doing some more amazing work. But I am so wicked excited that you've agreed to this.
That sounds like so much fun, Mary.
Well, thank you so very much, Amy. I really, really appreciate you giving me this time and, of course, speaking at the conference. So
thank you.
Thanks, everybody. And we'll see you later.
See you soon in Belgium.
Yeah.